Hello, and welcome to the Bird Island Wellness Podcast. I'm your host, Julie Kane, nurse practitioner and hormone optimizer, and your guide on the path to feeling like you again.
And I'm Heidi Mullins, co-host, cheerleader, and your go-to gal for real talk, laughs, and lots of learning along the way.
We're so excited to have you here with us today, whether you're tuning in from Newfoundland and Labrador, Alberta, or anywhere else in the world. We want to make this your safe space for honest conversations about hormone health, weight loss, and everything in between.
That's right. No shame, no judgment, just real stories, expert advice, and a whole lot of support. We're here to support the questions you might be too nervous to ask and bust a few myths while we're at it.
So grab a cup of tea, settle in, and let's get into it. You deserve to feel amazing, and we're here to help make that happen.
Hey everyone, on today's episode, we are going to dive into menopause and mental health. So I know we all have a lot of questions on this topic. So I'm super excited to ask Julie everything that she knows. Hi, Julie.
Hey.
Hi.
How are you?
Good. How are you?
Good.
So first question I have for you are, what are the common mental health challenges that women face during menopause?
Okay. So mental health and menopause are, it's a very unfortunate time where women were kind of at our peak, like 40 plus, where we're at our peak with our careers. Our kids are, usually a little older and can take care of themselves. And we are going through this roller coaster ride during perimenopause where we kind of feel like we're losing it a little, I guess.
Yeah, a little bit.
It definitely, the mental health aspect probably doesn't get talked about a lot. But I do see a lot of patients who are like, I don't know what's going on. I don't know what's wrong with me. Like, you know, I typically am a happy person, all is good in the world, and now I feel like, everything is falling apart.
Yes, well, that's what happened to me. I felt like I'd never had anxiety before, ever. And then all of a sudden, out of nowhere, I had this brand new anxiety. So,
Yep.
yeah.
The struggle is real. So what's happening during menopause, perimenopause is that, perimenopause could arguably be more challenging, I think, because we have estrogen levels that are going up and down and progesterone levels that are declining. And these hormones are so important for our mood and balance. So like it's just, I just describe it as like a roller coaster. And yeah, it's so hard because for some women, they don't have hot flashes. They don't have night sweats. So the whole mood aspect, the whole mental health thing is like, you could never have had issues with depression or anxiety in the past, but hello, now here I am. Like, what's going on?
Exactly. Yeah. What about brain fog? Is brain fog something that is related to menopause?
Yep. Huge impact on women. Memory issues like, oh my gosh, I can't remember the name. I can't remember the name of the place. Like brain fog is something that, due to loss of estrogen and varying levels of estrogen, it definitely impacts women to the point of I have some patients who have to take time off of work. Yep, it is a real thing. Brain fog is real and it should be addressed.
And what typically would help with brain fog?
So here's where the whole hormone replacement, therapy comes into play because you want to restore levels like your thyroid, your if you've gone through menopause, you definitely want to restore your estrogen levels. Progesterone helps with sleep so much. So, like, just having good quality sleep can help with brain fog. Like, if you don't get good sleep, you're not able to function.
That was me too. I was not able to sleep at all. Like I just couldn't sleep, and I would go to bed so tired and be like, "Oh, I'm going to sleep like a baby tonight." Mm-mm. So now that I'm taking progesterone and magnesium, I'm sleeping like a baby. sleeping
Yep.
sleeping as good as I can sleep.
Yep.
So
Yep.
it really, really helped me so much, so much.
Yep. So,
So
like,
that's
sleep is one of those things where, you know, we think it could be because we're stressed out, or,
mhm,
you just whatever, like, and it's a very slow, your body compensates for so long, but, like, common things are like, I wake up several times a night and I can't get back to sleep. And it's like, that over time significantly can impact your mental health and just your day to day. Do you want to exercise? Do you have
mhm.
energy? Like, sleep is such a huge factor.
Yeah. And what about lifestyle factors like diet and exercise? Um, how does that make a difference, or do you think it does?
I think diet and exercise definitely play a huge part in when women are going through menopause, perimenopause. Exercise, it's almost like, it's our release. So, regardless, I don't mean you need to go to hit the gym every day and, like,
Mhm,
lift weights, even though that's super beneficial for older
mhm,
women. But just a walk, like an evening walk, a morning walk, is so therapeutic. You kind of just, it's almost like meditative, where you're thinking about things and you're just relaxing. Exercise is like, we don't put enough emphasis on it. We need to make it more of our daily routine.
mhm.
Food, nutrition is also a huge part, because if you're not eating well, you're not going to feel good. Like, it's one of those things where, you are what you eat. Food is medicine. I
Mhm,
can't, we know all that. And we just need to do a better job with, making sure we get what our bodies need every single day. And, if you're eating out all the time, eating crappy food, you're going to feel like crap. So
mhm.
that's a huge piece.
And like you said, if you can fix your sleep, then you're probably going to have more energy to make a
Yep.
healthy meal or
Yep.
go for a
Yep.
walk, right?
Yep. Yep. Yep.
So,
I do. I hear patients say, usually it takes a few months. So, with
mhm,
hormone replacement, it's not going to be like overnight.
mhm,
Tomorrow I'm going to feel great. It usually takes time. But usually within a 3 month, 6 month window, patients start feeling like they have energy again, that they
mhm.
want to do things. So, yeah, I think it has a huge impact for sure.
That's awesome. For me, when the progesterone that started working for me really quickly, like
Mhm.
within the first couple weeks, I
Yep.
was sleeping better.
Yep.
So thank you for that.
Yep. No,
that
no,
was
no.
amazing.
Yep,
So,
progesterone for sleep is definitely a game changer.
mhm,
I have had patients who, like, send me a message a few days and they're like, "Hey, does this work like the very first time you take it?" And I go, "Well, it depends on the person. It can, which is great for those people who have been struggling. But yeah, sleep is, like, definitely a game changer for sure."
okay, awesome. And are there specific therapies or treatments that you'd recommend for managing menopausal mental health symptoms?
So when it comes to mental health, you want to make sure that, there's no underlying issues, there's not relationship issues or other things that could be causing your mental health issues. So it's something where You definitely need to seek a, professional medical provider, um, regardless if it's hormonal or just, an underlying process, that you definitely need to seek somebody out to make sure. Um, strategies, I mean, strategies, you do all the things. You do the good sleep, you do the exercise, you eat healthy, you try to decrease stress. So, like,
Mhm.
meditation is a great thing, deep breathing is a great strategy, but if at the end of the day you're doing all of the things and nothing seems to be helping, that's when it's like, okay, I can't continue like this. I need to go see somebody, because there is help. There is help out there.
Awesome. Awesome. And I guess if somebody didn't have any mental health issues all of their life and then all of a sudden they just pop out of nowhere,
Mhm.
maybe it might be a good idea to get their hormone levels checked just to
So,
see.
yep. Research shows women in perimenopause, menopause are at such much higher risk for depression and anxiety, for, like, they've never had issues in their life, and now all of a sudden here we
Mhm.
go, and it is a real thing. Like, where I know coworkers, they come to work and never had issues doing certain procedures, like nurses, and now,
Mhm.
why am I anxious? Like, why all of a sudden has this become a thing?
Mhm.
And, I just, hey, now it's time to get your hormones
Yes.
checked. So that's the deal. Like, you
Mhm.
have to look, because if it's not something that you can pinpoint, well, it's
Mhm.
because of this or because of that, then the hormonal thing is a real, and it happens to every single woman.
Mhm.
It can happen earlier for some women in their late 30s. If you've had a hysterectomy, these are all things that, hormones provide our bodies with benefits, how we feel, how we operate every single day. So if we don't have them, here's where, it could be related to your mental health.
Mhm. Wow. Yeah, it's funny you said that because I about your nurse friends, I actually got grocery store anxiety. I started getting anxious when I would go to the grocery store and I'm like,
Mhm.
okay, this is
Yeah.
just weird.
Yeah. Yeah.
Nothing bad is going to happen to
No,
me at the
no,
grocery store.
no.
So that's
Yeah.
I'm
No,
happy
it
to
was
say that
actually,
that's gone now. So
yeah, it was actually a friend of mine who, she would, like, and it was a simple injection, and, she's like, "I don't understand. I don't get it. Like, I don't," and she would, like, start sweating, and, like, she's like, I've done so many things in my nursing career. Like, you know, and why now all of the sudden? Now why can't I just do this simple little thing? Like, it's related to hormones. I'm
wow.
sorry. Yeah.
Wow. Wow. Do you have any last question? Do you have any like resources or books or websites or anything that you'd recommend to anyone wanting to learn a little bit more about menopause and mental health?
Yep. Yep. So there's a great book out there from a doctor. Her name is Taz. I mean, I know her as Dr. Taz, Taz,
Yep.
but she has a great book called The Hormone Shift. And
Okay.
she's a doctor. And basically, the whole book is all about, the beginning is about her journey. She, again, doctor working in an ER, where she was going through hormonal issues and nobody could diagnose her. Doctor after doctor after doctor, lots of things. And she just basically had to get educated, figure herself out, all on her own. And she goes on to talk about the different phases of the female, um, transitions through life, like, puberty, all through,
Mhm.
and like different. Um, it's a great book. where you can get great insight on the different stages, perimenopause, menopause. And I think she does a great job explaining it because, there are there's so many misconceptions about hormones and things like that, but she does a great job. It's a newer book, so a lot of the information is current and good. So I do recommend that book. If you are, looking for hormone replacement therapy, it is important that you definitely find someone who understands hormones and please don't go out and treat yourself. Like I hear a lot about people, taking um, their husband's dose or whatever of
Oh
testosterone.
gosh.
Please don't do things like that. I know it's a challenge with finding providers in Newfoundland, but make sure that you do your body and yourself due diligence because there are people out there that do understand it. So yeah, yeah.
Well, you're definitely one of those people, Julie. You've helped me so much.
Yeah,
Thank you so much.
it's one of the I had to figure myself out
Mhm.
and I saw many providers who, didn't understand and, we're all looking to just feel better. And that's the goal is to just feel better and have a better, you know, transition through menopause and then another 40, 50 years after that.
Amazing. Thank you. Thank you so much. What can we look forward to in next week's episode?
So, next week, I would like to talk about testosterone therapy for both men and women, and the benefits and kind of what we see with patients. And yeah, testosterone is the next topic, the other hot topic for
Amazing.
next week. Yep.
Can't wait.
Awesome. Thank you all for listening in. And if you feel like you have people in your family, friends who could benefit from listening to this podcast, please share. You can also follow us on Instagram or Facebook, where we share lots of information with hormone therapy and weight loss. Thanks for tuning in.